overhauling the healthcare system is America's top priority.
All right. Hello, Hugo. How are you doing today?
But some doctors and nurses are not waiting for reform. They're doing it themselves.
Like that.
Stick your tongue out. Ah!
Many patients already have affordable quality health care without a government plan. Dr. Alan Dappen is a family physician who has decided not to accept Medicare payments. Now his practice doesn't have to see 100 patients a day to meet its overhead.
We were on an increasing treadmill that got worse and worse all day, so that rapidly became this drudgery system of just spending all day in the office day after day trying to process more and more patients.
Dr. Dappen left his traditional practice to start his own, where he'd have time to talk to his patients. Now his practice does what's best for the patient, whether it's a phone call, an email, or a house call.
It's actually really fun to meet people in their own environment. It puts you as the doctor kind of more as the patient, and it puts you a little more on the kind of entering their territory.
Today, DocTalker Family Medicine offers hassle-free, affordable health care by charging patients for time, not procedures.
Oh, good.
Oh, good, good.
How's George been doing?
Oh, you need to look at him.
Is he as feisty as ever?
Oh, yes. Come on in.
One thing that I really like is the ability to do whatever I feel is necessary for my patient and to focus on the relationship. We believe that a patient needs to have the ability to use us when they need us, to expect to have us spend the amount of time that we both feel is necessary for whatever's bothering them, and to not focus on paperwork, Medicare regulations. It's a very freeing experience to be in a room with a patient and to feel like that's it, that no one else is a part of any decision-making process.
If government-run health care is adopted in the United States, it might resemble a system that Valerie knows has its own problems.
The wait times in the NHS system are significant. My relative in England waited 1.5 years for a hip replacement and was quite, had a lot of pain, was unable to walk a lot. In England, there is a waiting list for surgery that is considered something that can wait.
For the past 7 years, the DocTalker medical team have been pioneers of patient-centered care.
I had a mentor in medical school who used to tell me that before I retired, I would become a government employee. But when I came out of medical school and residency, nothing was as I expected it or had hoped it would be. I was unable to focus on patient care. I found myself instead focusing on everything but patient care. It was paradoxical at best. And today, when I come to work, I'm dealing with relationships, people, and I am focusing on healthcare now.
As family physicians, we go into job to be in relationship with our patients, to help the people to do the right thing for the right reason. And we've been focusing way too long on all these other externalities and not the patient. So it's to get us back into doing our job again and restoring integrity to primary health care.
Check your blood pressure here.
We're both over 80 years old, and we need help at different times. We need medication. We need someone to talk to.
I have had problems, medical problems all over the world. I've been in 70 different countries. And this is the only service that's complete. Doesn't make any difference what's necessary. It's done, and it's done properly. It's responsive.
Thanks so much.
Whatever our needs are, he sees that it's taken care of. As long as you have that available, you just might live forever.